So now I'm going to demonstrate for you how to insert an epidural. Again, we're going to make sure that we have patient's consent, that we check the chart for their past medical history, make sure they have no coagulopathies, verify their platelet counts, gather our materials, our supplies. We're going to make sure that we have our cap and our mask ready. I'm going to start by putting our mask on. Again, patient's going to be sitting up in the angry cat position or cook shrimp position where they really push out their lower back. On this mannequin, we can really feel the hips there and note where L4 is and where we're going to go between L3 and L4. And again, I'll use my finger to put a little mark there. Okay. I'm going to open up our kit. Gloves. I'm gonna go get sterile. Make sure I have my watch off, my badge off. Nothing to fall into the sterile field. Again, just for demonstration purposes, I'm not going to use the betadine on the mannequin. You open up your betadine, pour it into the area there. Again, 3 times with the betadine. We're going to dab, dab, dab. Start in the center, work our way out. Dab, dab, dab. Start in the center, work our way out. Again, take a step back to open up the drape so you're not touching anyone or anything with it. We have our sticky part at the top. Again, the hole where our insertion point is going to be is in the middle. We're going to line it up with where our point is going to be. I pull off the sticker away from me or away from my kit. You can sort of tuck it underneath the buttocks, which will help prevent anything from spilling. Again, landmarks I'm feeling. If you want to move your drape up a little, you can. Now as the betadine is drying, I'm going to get my kit ready. This is what our glass syringe looks like. Again, this is what we're going to feel for loss resistance. Very low friction, slides very easily there. Okay, so in this kit, again, 3 ml syringe with an 18 gauge needle attached. I'm going to draw up 1% lidocaine with that. And there are little depressions and holes in here that will properly seat your medication so it doesn't fall over. So again, draw out 3 cc's. And then I'm going to attach my 1.5 inch 25 gauge needle. So after that, I'm going to have my 2E needle, which I'm going to loosen the top off. And for our glass syringe, I'm going to draw up normal saline. Found if you sort of tilt it on the side, you can draw up very easily. Some people do a combo of air and saline. I usually just do saline. Right. And then make sure you open your catheter at the end. Okay. Now, again, I'm going to come back here. If the betadine has not dried, I would take gauze, dab it off. Again, feel insertion site right there. I'm going to do a little skin wheel, go in. I did not hit the spinous process, draw back to make sure I don't get CSF, inject as I come out. And again, some people do this and some people don't. Some people just do the skin wheel and that's it. I'm going to take my 2E needle. Again, you'll see where the skin wheel was. I always make sure I'm straight up from the buttock. Provided they don't have any sort of scoliosis, you'll be right in line with the spinous processes. And then I'm going to feel, again, the spinous process and go right above it. So I'm going to go in 1, 2, 3 centimeters. It's starting to feel pretty well seated here. So I'm going to stop and pull out my stylet. I'm going to attach my glass syringe. I'm going to give a little push to feel, not going easily, so then I go millimeter by millimeter here, checking. So it's sort of little bouncing movements, but you want to make sure you get a good push to see. And it's sort of difficult with the dummy moving, but millimeter by millimeter. Test again. Test again. And there I have a very good loss resistance. Goes right in. So then I'm going to tell the patient, please try and stay as still as you can. We're almost finished. And take this off. This is only coming out because it's a dummy. Open up the catheter. Ideally, you want to try not to touch the tip that's going to go into the patient. So try and grab this little marker here and grab the other end. So thread it in. So at the tip there, right there, you can feel a little resistance right as I'm coming out of the end there. And so then I hold very steady. I push little by little until it goes in, advances easily. I'm gonna hold my tip. I'm gonna sort of advance as I pull the 2E needle out. Always control the tip. Right now I have it back in the nook of my hand there. All right, so I said there's always a holder for your catheter here. With this one, it's this little mechanism here. And the tip slides in here. And then this goes down to lock. And then you're going to attach onto here your filter. And if you already have medication drawn up, you're going to then attach it here. So you have a totally closed system. And then at this point, I'm going to hold this catheter in place so it doesn't come out of the back. I want to verify my landmarks. So right now I'm about 20. I'm going to pull back. So I'm about 9. And I'm going to hold it in place, peel off my drape. I'm going to put this over the patient's shoulder. It's a little easier in a real patient to keep it stable there. And then I'm going to take my tegaderms, which I don't have any in this kit, but I'm going to take my tegaderm, put a little loop here, and tegaderm here, and then tape all the way up the patient's back, hold it in place. If I'm going to bolus them, I'm then going to make sure that their blood pressure is stable. Again, they're getting 1/2 liter to 1 liter of fluid as this is going on. And that's it.